In this video, we're going to talk about electrolyte abnormalities in heat stroke. First comes potassium. So heat damages cell membranes, causes necrosis, ischemia, and that causes sodium-potassium ATPase pump to stop. So when this pump stops, you have no net movement of sodium getting kicked out and potassium coming in. So, however, you have potassium leaky channels. Potassium can still leak out of the cell, and that causes hyperkalemia. So anytime if somebody tells you like, hey, you have hyperkalemia in a heat stroke patient, now you know why it's happening, because of this sodium potassium ATPase pump not working. So when you have hyperkalemia, that reduces potassium efflux out of cardiac myocytes due to decreased concentration gradient. So concentration of potassium is too much outside in hyperkalemia, so there is less gradient for potassium to come out. So potassium stays inside the cell. So that positive potassium makes the cell positive, and cell is more likely to depolarize initially, and that causes arrhythmias. So you have small fluctuations in action potentials and causing arrhythmias, so particularly bradyarrhythmias. However, as it progresses later on, slow potassium depolarization inactivates sodium channels. So slow depolarization of potassium, that inactivates the inactivation sodium channels, which decreases depolarization, and this way it blocks the conduction pathways. And when you block the conduction pathway, heart is going to stop pumping and you're going to have asystole. And this process of potassium, slow potassium depolarization inactivating sodium channel, this is called as a process of accommodation. Now comes sodium. So heat damages cell, that causes necrosis, ischemia occurs. You have sodium potassium ATPase pump and not working. Sodium gets trapped inside the cell. Cell becomes positive. Cell is more likely to be depolarized, and that leads to ventricular arrhythmias in heart, since sodium primarily depolarizes ventricles. That comes calcium. Calcium in muscle cells is sequestered in sarcoplasmic reticulum. We know that. Calcium is released from sarcoplasmic reticulum upon depolarization of T tubules, and that stimulates calcium release from the calcium release channels. These channels are also known as ryanodine receptors, and ryanodine receptor channels open to release calcium from sarcoplasmic reticulum. So what does heat do? Heat basically disrupts or denatures these ryanodine receptor channels. So these channels stay open for longer time, and this way more calcium is released in muscle cells, and that causes more muscular contractions, and that more contractions causes hyperthermia, further hyperthermia in the body. Increased calcium in muscle cell also stimulates calcium sensitive NADPH oxidases, NOx, plus nitric oxide synthases, increase activity of NADPH oxidases and nitric oxide synthases, increase the formation of reactive nitrogen species. So what do these do? So our reactive nitrogen species basically nitrosylates ryanodine receptor channels, and nitrosylation of ryanodine receptor channels cause the channel to open for longer time, allow calcium to release for longer time, and that more calcium is released in the cell and causing more muscular contractions and heat generation and this how they worsen the heat stroke. And you can read this article whenever you have a good time. Thank you.